Well, in Junction City, we have classes once a week, most weeks. Like next week, we won't. And I also send out emails once or twice, sometimes 3 times a week, with ideas about your health. And there is a link to that breathing website. So if you'd like, the email's free. If you'd like to make a list, if you have email, see, emails, if you don't have email, you should get it. There's just no way to keep up with the amount of information that could really help you without having email. And like I put a link on here, there's just no way to cover everything. So I put links on here, but you know how it is to type in a URL address? You know, it's about this long. And any of you remember the Commodore 64s?
Yeah.
You old guys do. Well, to play a game on a Commodore, you had to type in sometimes 4, 5, or 6 pages of code. And it'd take you a day or so, then you'd turn it on, it wouldn't work. So you had to go back and try and figure out where you made the mistake. But anyway, if you'll sign up for the email, I'm going to put this out as a email, so you don't have to worry about copying it. You could just, well, you copy and paste, and you'd have it. So if you want, you can put your email in. I don't sell the list, so you won't get a bunch of other stuff. Tonight, Fayreen asked me to talk about diabetes. Now, this is an introduction, but there is so much information available for you if you're diabetic to help you get off your medications, or like Dr. Tanton talked about in his book, reversing type 2 diabetes and losing fat, losing weight and reversing diabetes. It can be done. So this is an introduction to maybe give you some hope, because even though you may have your blood sugars under control, slowing down the complications, the blindness, the kidney failure, the poor circulation in the legs, the increased risk of heart disease, those things haven't slowed down much, even with the development of the medication and the use of insulin. So it's really a good idea to learn how to control your diabetes as much as possible without the use of medication. And it can be done. Well, what is diabetes? Now I'll start pointing fingers. Well, right at the first, I gave you a real brief, a little bit of anatomy. The pancreas is an organ that sits, or a gland, sits right across, kind of up under your ribs. It's both a gland that secretes hormones into your blood and a gland that secretes material into your intestine. So technically it's called an endocrine and an exocrine gland. There aren't very many of those, but it's one of them. Well, part of the pancreas we're going to focus on tonight are what they call the islets of Langerhans. That's a little spot that makes the hormones. It makes mainly insulin, but it also makes a hormone to help you store sugar as glycogen. And type 2 diabetics, which usually is an older person, is a situation where your islet cells aren't making enough insulin, or, and this is probably more common, your body's not responding to insulin like it used to. And so it's called insulin resistance. And when you don't get your insulin puts sugar into the cell. That's its main function. It does other things, but that's its main function. And if it can't get the sugar from your bloodstream into the cell, the high levels of sugar cause complication. Plus the fact that when you don't get the sugar into the cell, your brain is thinking, we don't have enough sugar. So that keeps raising your sugar, and it keeps putting out more insulin, and insulin has some side effects that aren't good. One of the main ones is that insulin acts like estrogen, and estrogen is an aging hormone when it's out of balance. So there's lots of reasons to keep your blood sugar and your blood insulin, some of them more down where they should be. Some of the more progressive doctors don't do the glucose tolerance test as much as they do insulin tolerance tests. So they give you a dose of sugar and watch what your insulin does. If your insulin levels are going high, then it usually means you've developed insulin resistance. Okay, so if we'll just talk about type 2 diabetes, the type of diabetes that occurs in older people, the insulin resistant diabetes, and now, excuse me. The first thing you should do, no matter what sort of a chronic disease you have, there's some basic underlying principles that you should consider. And I've listed those here. Number one, minimize your exposure to environmental chemicals. Chemicals are poisons. That's why they kill bugs and weeds. You really don't need the deodorizers, the dry cleaning as much as we use it. No one ever dies from dandelions, and we don't need the ortho man coming to your home to kill the bugs on a regular basis. There's an epidemic of Parkinson's disease, and some of these are related to environmental chemicals. And a very interesting teaching moment in my life when, 30, 40 years ago, we, like so many people, we bought little chicks at Easter time because the kids thought they were so much fun. And a day or two after we got them, I was out in my front yard with my little whirlybird, putting the dandelion killer pellets on my lawn. And the next day, half the chicks were dead because they were out there picking them up too. And the other half of them were laying there with the tremors. And so I just decided then that dandelions aren't that bad. Because, you know, I was walking over it and I was tracking it in the house and the kids were playing in the lawn. So, it's once you get Parkinson's, it's a real problem. And we don't have any real good treatments for it. So, it's best to avoid it. So, minimize your exposure to things you have control over. There's lots of things you don't have control over, and so you can't do much about that. Clean up your environment. Clean up your diet. Let me read you a quote regarding artificial sweeteners. Unfortunately, a lot of these are marketed directly to diabetics. Now, let me read you a quote from a neurosurgeon regarding aspartame. This is written by a neurosurgeon, MD, and it's in his book called Excitotoxins. And he said, the weight of evidence is overwhelming. If you want to avoid obesity, metabolic syndrome or diabetes, neurodegenerative diseases like MS and Parkinson's, and cancer, and if you don't want to make your cancer more aggressive, then you need to stay away from aspartame. That's pretty strong. Now, this is written by another MD, and he said, taking my diabetic patients off aspartame led to an immediate improvement in their disease. One more quote. Aspartame can precipitate diabetes and stimulates and aggravates diabetic retinopathy, that's where your eyes go bad, and neuropathy, that's where you get your numbness in your feet, and destroys the optic nerve. So there's really no reason to use artificial sweeteners. Do you know what happens to aspartame when you eat it, drink it? It's converted into formaldehyde in your body. And formaldehyde is considered a poison. So no matter what the advertisement says, don't. Okay, stop. Oh, the other thing, microwaves are another kind of a tragedy on the American people. Barbecued food is carcinogenic, causes cancer. Now, I'm never gonna, I doubt if I could ever convince anybody to never eat a barbecued piece of meat again. But don't make it a habit. Because when the fat from the meat drips on those very hot briquettes or whatever, then that smoke that gives the meat the flavor has become carcinogenic. Okay, minimize your need for medications. Most, if not all, of the medications that people are given for diabetes deplete your body of the vitamins and minerals and amino acids that you need to prevent diabetes. Now that's a pretty strong statement, I know. And I'll refer to this book again. Dr. Tanton, in his book, goes through almost every one of the medications that are prescribed for diabetes, and looking at the literature from those medication packages, it describes there the vitamins and minerals that are depleted from your body when you take those medications. So now you don't go home and stop your medication, but you learn what you can do to reduce your need for medications. And in some ways, diabetes is a nice do-it-yourself type disease because you have a way of measuring. You can measure your blood sugars right along and watch to see how you're doing. So, no matter what disease you have, clean up your act. Minimize your exposure to chemicals in the environment. Clean up your diet. Minimize your exposure to medications. And if you're on synthetic hormones, talk to your doctor about getting switched to what we call bioidentical hormones. Synthetic hormones cause cancer. They age you more rapidly. Okay, now there's basically 3 food groups. Someone name one of them? Protein, very good. Another one? Fat.
Carbohydrate.
And carbohydrates. Okay, those are the only 3. Everything's kind of a mixture of those. Can anybody think of another one? I've heard of it.
Spam.
Spam, Okay. I kind of like spam. I grew up on spam, fried spam. I can almost smell it. Okay, now, which of those food groups raise your blood sugar? Carbs. Does eating a piece of bacon, let's say it's real bacon, does that raise your blood sugar? No. Does eating a piece of cheese? No. The only thing in your diet that will raise your blood sugar is carbohydrate. So keep that in mind when you look at your diet. Now, I know some of the things I'm going to talk about are in disagreement with the dietary guidelines of the American Dietetic Association. That's okay. I just want to give you a choice, and you can go home and decide what you want to do. But unless you severely restrict your carbohydrates, you probably won't get off medication, lose the weight you need to lose, and develop more insulin sensitivity. In fact, I don't know, recently there's a diet has come up, it's called the ketogenic diet. Now, it's been around for some time. It's very interesting. The ladies had a son with severe seizure disorder, and the doctors had them on one medication and another medication that couldn't control the seizure. But so she went home and did the research, and she found when she put her son on a very high-fat diet, his seizures were controlled. It's called a ketogenic diet. And so now it's becoming more, and now recently they find that a ketogenic diet will control cancer. Cancer cannot thrive on ketones, but we can. And so they're finding you can get rid of some cancers by putting some people on a very, 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 very low carbohydrate diet, a very high fat diet. It's not real pleasant at first, but neither is cancer. Okay. Now the other thing as goes along with, have you all heard of what we call the glycemic index? Okay. Could one of you describe it for us? I'll teach you to nod your head.
Well, it's foods that
the sugar doesn't go into your bloodstream so fast.
Yeah, exactly
Because
right.
they're
It has to do with how
higher.
rapid your blood sugar changes in a period of time. Some foods, your blood sugar go up quite quickly, other foods. Now, the general principle is, the more refined a food is, the higher the glycemic index is. And so, and that's why one approach, and the one kind of used by the dietetic association, is to make sure you eat whole grains and a high fiber diet, because that'll slow down the breakdown. Fiber and carbohydrate go together. There's not much fiber in a piece of, pat of bacon or a piece of cheese. And so the fiber goes with the foods with that are sugar. And so by eating complex carbohydrates, your blood sugar changes slower. But even for some people, everybody's different. See, for one person, a potato may be a high glycemic food. For another person, it doesn't seem to affect them. And that probably has to do with a sensitivity to that food or an allergy to that food. Some people have well, we don't know for sure, but you've got to find out for yourself. And so if you choose to try and go on low glycemic foods, you've got to continue testing yourself. Because what the paper says is a low glycemic food for you may be a high glycemic food. And it doesn't stay the same. It may change after a few weeks. Okay, so your diet basically needs to be low carb. The Atkins diet, you've probably heard of that. That's a good place to start. Unfortunately, that's changing. You can go to most grocery stores and find Atkins candy bars and Atkins this, But the other thing that I have learned that most people need to do is go totally off grains initially. Grains are almost always high glycemic, and grains are very addictive foods. It's my personal opinion that most alcoholics have a grain sensitivity and what we call a brain allergy. So it isn't their pancreas that goes crazy when they eat the food, it's their brain that goes crazy. I should have brought a picture of, it shows the writing of a child, and the child was writing pretty appropriately for her age group, and then you gave that child milk or potatoes or some other food, and the child totally lost the ability to write. It just started scribbling. But she didn't get wheezing, she didn't get a rash, she didn't get a runny nose, she didn't get belly aches. It was just her brain reacted. And so a lot of people have brain allergies, and a lot of people have what you might call a pancreatic allergy. You eat the wrong food, your blood sugar's going to go up. So you've got to learn what fits you. But some general rules are low carbs, no grain. There's a diet out called the zero carb diet. Yes.
How do you know if you have a brain allergy?
Pardon?
How do you know if you have a brain allergy versus a different allergy? 'Cause
How do you know if you have a brain
allergy versus...
Well, if most of your symptoms are mental, or every time what's the old adage for an alcoholic? One drink is too many and 1,000's not enough. That's one. You should try to go, everybody should be able to go 24 hours without eating and feel okay. That's a real kind of a broad screening test. But if you can go 24 hours without eating and still feel pretty normal, you'll get hungry. Then food allergies probably aren't a major problem. But as we'll point out later, if you're depressed, if you have anxiety, if you've been told you're manic depressive or obsessive compulsive, if you have a child with ADHD or ADD or something like that, allergies are probably part of the problem.
I have a little granddaughter who's 9, and she feels like she gets all funny in her head, and she asked me to try, because she knows I'm into supplements and all this stuff, and she asked me to try to find something to help her brain.
Well, if something like that, the first thing to do is try and get something like that to stop eating get her off gluten. That'd be great. Make sure she's not getting MSG. Yeah. MSG is a poison. Right. So if you can clean up her diet and keep a journal, next time she comes to you with that complaint, you say to her, okay, let's go back over what you've been doing and what you've been eating. And you keep that in a journal, and then after maybe the second or third time it's happened, you can often see a pattern. So, okay. Food allergies can affect any part of your body. It can give you diarrhea, it can give you arthritis, it can give you headaches, it can give you irregular pulse, it can, you name it. Food allergy can affect any part of your body. And so, okay, so in a situation like, let's say, you want to see if the foods are which foods are raising your blood. Well, I'd say the first thing I'd say was go totally off grain and watch what your blood sugars do. If you're on insulin, you've got to monitor yourself carefully, but you can do it safely. Just go totally off grains and see what your blood sugars do. And then you can experiment with other foods. And then you may have to go off potatoes. The zero carbohydrate diet is basically above ground vegetables, no grains, and meat and cheese. So you get plenty to eat. It's just not what we're used to eating. Someone estimates that 65% of the calories of the American people comes from grain. So.
So what's the deal with the above ground?
Well, what are the beneath the ground vegetables? What are they? Potatoes and beets and carrots and yeah. And if you ever have a glass of carrot juice, you know how sweet it tastes. Yeah. And where do they make what you and I sugar was what? Beet sugar. Yeah. So most of those are high glycemic foods that tend to change it. You can probably Google that. I tried to find a copy of the zero carb diet and I couldn't find it. But you can probably Google it and find it. Okay, so sweeteners, no. That's easy. Do you need sweeteners to survive? No. If you really got to have something, then use stevia or xylose. And if you notice down here a little later, stevia is good for diabetics because, I wrote that down here someplace. Well, I guess it got cut off.
No.
Oh, here it is. It revitalizes damaged beta cells. Now, beta cells are the ones that make your insulin. Now, that's more helpful for a type 1 diabetic, but so it's probably pretty safe for you. We all probably, by the time you hit 40 or 50, we probably have beta cells that are worn down. And these things aren't absolute pure things. The type 2 diabetic may have trouble making insulin as well as trouble utilizing insulin. And so these things are reasonable to consider. So stevia or xylose, small amounts of honey. Yes?
What about alcohol sugars like xylitol, mannitol, and some of those?
Well, xylitol is probably okay because it doesn't affect your blood sugar level. But with xylitol, you've got to be careful that it doesn't come from China.
Right.
Because we don't know where it comes from.
They come-
I don't know what's in it. Yeah. No, those things, stevia and xylitol, don't change your blood sugar, so it's not going to affect the insulin. So it shouldn't. It just affects your tongue and your mouth.
Yeah, the birch tree xylitol, I was told, was the best.
Yeah,
Which
made in
one?
America.
Birch tree.
Yeah. Okay. Now, I've listed at the bottom here a list of supplements that will help stabilize your blood sugars. And these are things that probably not in the mainstream, but there's a lot of this information available on the internet, and I try and put it in my email that when I put it out on a regular basis. But you can see it. But number one, especially if you've been on diabetic medication for a while, you need a good vitamin mineral preparation. Now, in this book, I've got the site there. You can go online, and it's drtanton.com. He's got this book, and he goes through all these things in great detail. But he's got a chapter here that said 15 nutrients that affect blood sugar levels. And he goes through a variety of things, but most of these you can get if you're taking a good quality multiple vitamin mineral preparation a couple times a day. See, in reality, old age is malnutrition. That's all it is. When your body doesn't get what it needs in the right quantities, you start to break down. And each one of us breaks down a little bit differently. One will get diabetes, one will get arthritis, one will get some other autoimmune disease or cancer, something else. But every one of these diseases has been found to respond nicely to vitamins and minerals. Now, why don't you think we read about that? Why doesn't your doctor tell you that? Because you don't make much money selling vitamins. If you get on our email list, you'll get some links. Okay, you'll get some links to some websites that will go into this in greater detail. What was your question?
Well, I've been diagnosed with Parkinson's, and other than the chemical that you were talking about, it's never been explained to me what causes it. Do they know?
Yeah, well, one theory is you've been exposed at some time in your life to chemicals that damage your nervous system.
Oh, I was. You know what? I was in the Army. We had to go through the gas tank.
And that's one place. But see, you could have stayed overnight in a new motel room. So you could have put new carpet in your home. You could have gone someplace. You know, some grocery stores spray Raid. And I'm sure you're all reading now about the toxic effect of Roundup. See, so we've all been exposed to that, and we don't know why some people are more sensitive, but it may just be that your liver's ability to break the stuff down and excrete it. We won't get into you as in detail, but if, for example, if you're constipated, then your liver's trying to get rid of that stuff. But if you're constipated and that material stays in your colon for 2 or 3, 4 days, then you're going to absorb much more of it. So there's a lot of variables that can determine. You should ask me after. There's a website you can go to learn about something that shows great promise with Parkinson's. Okay, but if you look at this book, it goes through all the different nutrients and the fact that traditional diabetic medicine depletes your body of these. It's a real sad situation, but it's the real world, so we have to deal with it.
Does that include metformin that so many of us are on before insulin?
I can't hear you.
Does that include metformin, which so many of us are on before insulin?
Yes. Yeah. Metformin does some good, but see, the whole focus of the diabetic industry is to your blood sugar levels. Try to keep your A1C and your blood sugar, keep those, and if you can do that, you're considered well controlled. But that doesn't slow down the side effects and the complications, the long-term complications of diabetes. That only comes about if you get yourself healthier. And in fact, we'll talk about in a few minutes. Well, let's talk about it right now. Dr. Broda Barnes, not much of a book to look at, 40, 50 years ago, found that when his diabetic patients were getting adequate amounts of thyroid, their blood sugars were much better controlled, and most of them did not get the complications of long-term diabetes, even though they may still have to take some of their medications. But getting your thyroid hormones to an adequate level seemed to be the difference in reducing the percentage of them that develop heart disease and cancer and neuropathy and retinopathy. Now, how do you know if you're getting enough thyroid? Your doctor will do a blood test, and that's almost worthless. Not quite, but the blood test for thyroid is wrong as far as determining if you need thyroid. We all kind of realize this in other parts of our life, where somehow we've been led to believe that the doctor says it, it must be true. But if you went to your auto mechanic because your car wasn't running, and all he did is look at your gas gauge, you probably know enough that there's more to my car than how much gas I have. Anybody doesn't know that? Okay. So, and basically that's what the thyroid blood test is. They measure TSH, and TSH is just to measure what we call thyroid stimulating hormone. And that's interesting. It tells us your glands are working okay, but it doesn't tell us how well thyroid hormone is working in your body. Thyroid hormone is critical for the normal functioning of every cell in your body. There's thousands and thousands of biochemical reactions that need thyroid hormone. And the best way to know if you have adequate amounts of thyroid hormone is to do what we call a basal temperature test. And I've given you on the first part of the second page, we talk about the basal temperature test. And what that is it's very simple. You stick a thermometer in your armpit first thing in the morning before you get up. Now, don't be too rigid. If you get up to go to the bathroom and then get back in bed, just do it then. We recommend you take it 7 or 8 days, and if your temperature does not come up to 90, it doesn't average 98 degrees, you need thyroid most of the time. Now, there are a few exceptions, but for most of us, and then there's a dozen books out in the market that helps you understand the symptoms of low thyroid. Unfortunately, your doctor is kind of forced into relying totally on the blood test. If he doesn't, he gets in trouble with the authorities. Okay, if you have a thyroid, if your temperature is average only 97 or 96, see, our bodies can only operate relatively efficiently if our temperature is somewhere between 99 and about 95. So there's only about 4 degrees in there where we're functioning reasonably well. So for every degree your temperature is less than 98, you're operating at about 25%, 30% less efficiency. And that's why when Dr. Barnes and the other doctor that recently wrote a book, and I wrote those books are here at the end, type 2 diabetes and hypothyroidism type 2, they found that when they got their basal metabolic rate or their basal temperatures up to the normal range, they didn't get the complications of diabetes. So that's almost as important as getting your blood sugar under control. And some people found that when they got their temperature under control and were taking enough thyroid, they didn't need nearly as much diabetic medicine. So you don't have to be heavy, you don't have to be sluggish, and you don't have to be the typical thyroid person. But it's been estimated that probably 80% of us are thyroid deficient. That's a huge number. And what the tragedy is, it's a huge correctable number of people. I mean, simple things can be done to make a tremendous difference in the health of a nation. Now, if you, for many years, you had to have a prescription to take thyroid. But now, I gave you an online site here, you can get thyroid without a prescription. Many health food stores carry a form of thyroid that's almost equivalent to a prescription. But you have the responsibility to learn enough about thyroid so that you can manage yourself without the need for your doctor. And you can do that. There must be at least a dozen thyroid books on the market. And all you have to do is Google hypothyroidism and you can find these books. The other major problem with thyroid is that most of us drink chlorinated water, or have for the majority of our life. Now, chlorine, well, maybe one or two of you remember your high school chemistry class. Most of you don't. If you remember that class, you'll remember that on the wall is this horrible chart called the periodic table of elements. And you always had to try and remember a lot of that. Well, over on the left-hand side of that is a group of elements with a valence of 1. And among those is chlorine and iodine, but also there's fluoride. And so when we drink water that's been chlorinated, we are taking in large quantities of chloride and fluoride, and commercial bakery products now or the dough is conditioned with bromide. All these things compete with iodine, and most of us are also iodine deficient. We've been told we shouldn't eat salt, which is wrong. They put a little iodine in salt to prevent goiters, but then they tell you shouldn't eat salt. And very few of us raised on sea vegetables. We might eat a little kelp once in a while, but almost everyone is iodine deficient. And when iodine is the molecule that your body makes thyroid hormone out of. So we're iodine deficient, we're all getting way too much chlorine and fluoride, and so our body doesn't have the raw materials it needs to make the thyroid hormones. And so we have several factors that contribute to this thyroid hormone deficiency. And I'm going to guess if you do your temperatures, contact me if your temperatures are normal. I doubt that any of you will have normal temperatures. Maybe if you're on thyroid. Yes?
What if you're taking thyroid medication?
Still take your temperatures.
Okay.
The other major problem is that almost every doctor prescribes synthetic thyroid hormones.
Right.
And almost every well, maybe I should, you can see this. You almost have to see this. Your gland puts out a molecule called T2. Well, your thyroid gland takes an amino acid called tyrosine. And if there's enough iodine around, it will hook 4 iodine molecules onto most of the hormone it produces. And 80% of what your body excretes from the thyroid gland is T4. But it also secretes small amounts of the hormone that's not quite finished. It'll secrete maybe 5% T2 and maybe 10 or 15% T3. Okay, but most of what your body puts out is T4. But if you don't have enough iodine, then the gland is going to put in here instead of maybe chloride or maybe fluoride, and that the body doesn't know what that is. Okay, now let's say everything's working right and you put out lots of T4. Now the doctors found that out, and so they said, well, let's give people that kind of medication. So we'll give you T4. Well, that assumes that that's going to work in your body. But the body doesn't use this. What it does, it converts it into T3, and T3 is what we hope gets into your cell to generate energy. But assuming, and then unfortunately this also goes to the brain where it regulates the secretion of TSH. But this doesn't tell us if it's getting in the cell. Okay, so the other problem is we've all been eating the wrong kinds of fats for the most part. We eat stuff that unfortunately much of the medical profession says is good for us, like margarine and canola oil and safflower oil, all these polyunsaturated fats, and your cell membrane is 3 layers of healthy fat. Now, can anybody tell me what healthy fat, some healthy fats?
Olive oil.
Olive oil's a pretty good one.
Okay.
One at a time, please.
Coconut.
Coconut oil. Have you ever seen coconut? It's that hard stuff that looks like lard. Wonderful stuff. Anybody else?
Avocado.
That's a vegetable oil. That's
Just regular lard, probably.
lard from a healthy pig. Tallow from a healthy cow. You know, our grandparents knew more than the doctor. So if we're eating healthy fats, we get healthy cell membranes, and this works. But if we're eating trans fats, and if we're eating that, these membranes break down, and we can't absorb these hormones. And it's not just thyroid; it's insulin too. That's part of the problem with insulin resistance. We're eating bad fats. Yes.
Could you just repeat that one sentence where you said if you're eating trans fats, you're something.
Your body tries to keep these cell membranes in repair and make new cell membranes, but you're making it out of poor quality material. Now, everybody thinks, well, it's here, so it's going to get in here. Remember the old Star Wars movie? Remember how the little ships came floating? I haven't seen any recent ones, so that's the only one I have to refer to as Star Wars. But the little tiny ships would approach the mothership, and they'd communicate with each other, and if they recognize each other, then the mothership would open up a little port. And then the ship would go in, the port would close, and the ship would get, and that's exactly how our body works as far as cell membranes go. You don't just bump up to it and it goes in. The cell membrane, it's an active biochemical process that allows these hormones to get in. And if it also has to do with your cell recognizing this molecule. Now this, if you've got a chloride and a fluoride molecule hooked onto this tyrosine, when it comes up here, it probably, the little receptor site probably won't recognize it. And so the hormone could be floating around, you could have a perfectly normal blood test, but your body's not getting the energy it needs, it's not going to function properly. Your risk of heart disease and cancer and diabetes and arthritis. If you look at this book, you'd be hard-pressed to find a disease that isn't going to get better by taking enough thyroid. It's sort of almost universal. It's really hard to treat diabetes if you don't have enough thyroid. It's really hard to treat cancer. It's really hard to treat heart disease effectively if you don't have enough thyroid. Because your body just can't respond in a normal way. So, yes.
As I understand that the synthetic thyroid that most people get is just T4, and that there are other varieties of
That's true.
that are the comprehensive thyroid that has all of them.
Almost all prescriptions are what's your levothyroxine? Yeah, that's synthetic T4. And so her doctor, like most of her doctors, and like the doctors at the medical school, unfortunately, in my opinion, think that's what she needs because her TSH does come down, so her brain is saying, hey, we have enough thyroid. But the rest of her body may not agree with that.
Is there something you can use naturally?
Yes, there's a website. You can get natural thyroid. Some people, you have to learn enough. You've got to take this responsibility.
Right.
Some people, just by adding iodine, they can monitor their temperature test. Now, just a word of caution, if you start getting better and your TSH may go down even further, and your doctor may say, I'm going to reduce your dose of thyroid, but you can kind of think in your own mind, well, that's okay, I know how to handle this now.
Yeah.
Yes.
I was curious, is butter a good fat? And also another question is...
First question first.
Okay. Is butter a good fat?
Yes.
Okay.
Now, ideally, it'd be organic butter, but most of us can't afford it.
And with the encouragement of people using fluoride, like fluoride toothpaste, etc., is that something that would be
You need
something to avoid?
Totally. Fluoride is a neurotoxin. One of the real bad things about fluoride is fluoride increases your mobilization and absorption of lead. Lead increases the toxicity of mercury in your body. Let's say we can believe the ADA or the dentist that says fluoride will reduce cavities in children. Well, children only comprise about 3 or 4% of the population. And what they want to do is medicate the entire population for the questionable benefit of this 3 or 4% of the population. It's a neurotoxin. One of the reasons Prozac works is because it's got 3 molecules of fluoride on it. It's one of the worst things that could happen to us. It's really interesting. One of the best ways to get rid of fluoride is to take iodine. People have studied this, and as you increase the iodine intake, the fluoride and bromide and chloride excretion go up dramatically. So that's another reason to take iodine. And men need it for their prostate, women need it for their breasts and their ovaries. Iodine is a very, very important part of our diet that we're missing. And you can't rely on salt. None of you are going to eat enough salt. You're way behind the 8 ball. You're way too late for salt and kelp. So,
Well, how do you take iodine? Just
you get a pill.
Oh.
There's a website called J. Crow's. Most health food stores carrying iodine now, and most people need about 1,000 or 10 times the recommended daily allowance. Probably should be taking 10 to 15 milligrams of iodine a day for a while. It'll protect you from the radiation coming over from Japan. One of the problems with that one type of that radiation is iodine 131, and if you're thyroid deficient, the place of high iodine iodine deficient. The place of high iodine concentration in your body are your thyroid and your breast for women, and your thyroid and your prostate for men. So if you don't have adequate stores of iodine, if your body gets in contact with radioactive iodine, it's going to absorb it and concentrate it in that part of your body. And you can't avoid what's coming over from Fukushima, and so you better start protecting yourself. Okay. Where are we? Okay. Let's talk briefly. Are there any questions about type 2 diabetes? I know this isn't all the answer. Yeah, we're just trying to introduce you. You really should get the book, one of the books. Go online and get that book and read and study and learn how to take your blood sugars, learn how to do your basal temperatures, learn how to monitor yourself with your diabetes. You don't stop your medication. You make the changes, then you gradually see as you improve, as your weight comes down, as you get better, then you can start lowering your medication maybe. But if you don't do that, you'll just end up with more and more and the complications.
Just a regular temperature thing doesn't work. You get a basal.
No, just get anyone in.
Just any of them will work?
It's hard to find a mercury thermometer anymore, but you can get non-mercury thermometers. Whatever you've got, use it.
Okay, they told me just to
Yeah, it may not be quite as accurate, but most people are far enough off that it doesn't matter if it's 97.8 or 98.8, 97.8 or 98 or 97.6. You'll see the pattern, and if you do it for 5 or 6 days, you will see what the average is.
Well, my temperature, very seldom when they check it is 97.
That's right.
Any time I check it, it's usually under 97.
Guess what that means, in my opinion? Most of us do that. It's exactly what most of us, the doctor says, oh, your temperature's 97. Oh, that's okay. See, all they're looking for is a fever. If you don't have a fever, you're normal. You go in there, if your temperature's 95, doctors haven't been taught that you can have a low temperature. You know why your parents taught you, read you Goldilocks when you were little? Nobody knows? Did anybody not get that story when they were little? And you don't know why your mother read it. Well, she read it to you so you'd learn, hopefully, that you don't want things too hot or too cold or too hard or too soft. You want it right in the middle. And you didn't learn that lesson. Well, now, I guess it's never too late. Now you can learn. You've got a head start.
What number are we looking for?
It should be 98. It says right here. It should average 98 over 4 or 5 days. Menstruating women should do it starting on the 2nd day of their menstrual cycle. Yes.
So what do you consider, when a person checks their blood sugar, what do you feel that the normal range is?
Well, it should be less than 100.
Okay. Because so many of them say, like I've had a blood test and it was like, 90 something, and it had the little H by it, like it was high.
Well, it is.
Yeah.
Do you know how they come to these numbers, how they come up with these numbers? Well, it's really kind of, there's some things you don't want to know. because it gets a little disturbing. I have a cousin that worked as a lab tech, and we were talking about this one day, and she said, well, whenever the lab wants to set a standard, they just measure the blood of the people that work here, and then we average it out and figure it that way. But most lab tests, it's something like this. If this is the amount and this is the number of people, almost every if you measure enough things, you get what they call a bell-shaped curve. Now, I really dislike statistics, and so this is not real high-tech. And 95% of the sample will be within what they just has determined 2 standard deviations from, I think this is called the mean. And if you're anywhere between here and here, you'll get it reported as normal or reference range. All that means is you're here. And many doctors, unfortunately, in my opinion, if you're anywhere in this range, you're considered okay. Now, in fact, there's a doctor right now this the medical board's threatening discipline on because he has some patients with testosterone levels here, and he's treating them. The medical board says, no, it has to be below this lowest number before you can treat them. Now, those of you that have children in school, if your child came home with a D minus, would you say, oh, you're okay, we won't worry about it until you flunk? Is that what your mom says when you get that grade? No. No, I mean, it doesn't take a real scientist to know that even now, anyway, I won't get, you'll get me on this. Okay, but that's how they determine it. So, in a blood sugar thing, 90's up here. In some labs, it might be right on the border. But have you noticed how lab tests change as the population change? You know, it used to be a cholesterol with 200 or 240 was considered normal, but now it's 180. Why do you think it's driven that way? Why do you think normal cholesterol now is 180?
Drug companies.
Yeah, they sell more drugs.
And more cholesterol, like
Yeah,
margarine.
sure.
Tell you that you need to eat margarine. And
That's right. It's all
no
driven by
fat
the.
food.
Okay, now, and so my feeling is your blood sugar should be more in the maybe 70 to or 60 to 80.
Okay.
That's my opinion. Even though you're still going to be considered normal. And some doctors, one of the reasons we're trying to educate people is because we're rapidly approaching a point in our culture, our society, when you're not going to get into a doctor very easily. And doctors are going to be controlled by a computer in Washington, D.C. And if you get to a doctor, you're going to get a diagnostic code, and that code will immediately go to Washington, D.C., and the computer there will tell that doctor how to treat you.
And what Medicare will pay for.
Well, we won't. That's obviously. Now, if you get in the system, you're going to have to be treated. That's the only way you're going to get treated. So, my objective in doing this sort of stuff is to get you out of that system, get you healthy enough, teach you how to take care of yourself so you can avoid getting on that conveyor belt. Now, I occasionally I got a call a while back, a patient I'd seen that we'd talked about some heart disease, but he was focused on asthma, and so he wasn't interested in heart disease. He was relatively young. Well, then several months later, I got a call from him, and he says, I'm in the hospital, I've had a heart attack, and they want to do bypass surgery. Well, you say, at that point, you say you get the bypass surgery. See? But see, he should have said, my dad died at a relatively young age, I am more susceptible, so I've got to pretend that I've got heart disease right now. Once you get in the crisis, once your doctor says you need surgery, it's almost too late. You might prevent a second surgery, but you aren't. So you got to think ahead. If your dad had diabetes, you pretend that you have diabetes. Learn to measure your sugar. If your mom had cancer, you just got to be proactive, or you're in big trouble. Okay, pardon?
Oh, I was just telling her you don't want to have a heart attack like I did at 53.
No, you don't. Okay, but if everybody was on the right amount of thyroid, if everybody was taking iodine, we really probably could put the medical business out of business. Okay. Type 1 diabetes. Now, I don't think any of you probably have type 1 diabetes, and you aren't going to have children that are going to have, but you may have a grandchild, you may have a daughter that's going to have babies. So keep these things in mind. One real simple thing you can do to prevent type 1 diabetes is to get a pregnant woman on vitamin D. Just vitamin D reduces the incidence of childhood diabetes by some ridiculous number, 50 or 60%. That's all it takes. It's 10 cents a day. It's tragic that this isn't in the newspaper. So, type 1 diabetes is considered by most people now to be an autoimmune disease. And that means that person is making antibodies to himself. And that is usually because of environmental factors or an infection. But what makes someone more susceptible, you almost always hear, well, you know, she had a bad case of the flu, you know, a month or two ago, and now they're diabetic. Or we moved into a new house, and now they're diabetic. What's the best single protection against all that? Vitamin D. Vitamin D is just super stuff. And again, we've got this problem. You know, the sun comes out and everybody says, put sunscreen on, wear long sleeves, wear a hat, stay out of the sun. Your chances of getting a disease from a vitamin D deficiency is at least 1,000 times greater than you would get a skin cancer from sunlight. It's ridiculous, the difference in the risk factor. Take vitamin D. Reduce your risk of colon and breast and prostate cancer by 75%. Is that a number? And childhood illnesses and anyway, okay. Autoimmune.
What amount did you say for children?
Pardon?
What amount of vitamin D for children?
Most people are now saying at least 1,000, maybe 2,000. In a pregnant woman, it should. The vitamin D council in the books are saying 5,000. If you think you're getting too much, you can get a blood test. And it's rare to see anybody that's got the right hand end of that curve. Almost vitamin D deficiency is all 80, 90% of the population.
Does it need to be,
D3.
D3, okay,
And that's an animal source vitamin D.
okay, so that dry,
Vegetarians are not going to get enough vitamin D.
so that, there's a form that was inexpensive that one doctor suggested we get it, but I think it was a dry form, it was in this little.
Of what?
I think it was a dry form.
Just
because-
read the label.
Okay.
It should be D3.
Okay,
Now, I've ever heard recently you can get some vitamin D from mushrooms. I haven't, but it's, yes.
One thing you have to be cautious about is the source of the vitamin D. Some of
Okay.
these, there have been a doctor I know who had patients with low
Vitamin D level.
vitamin D levels. They put them on vitamin D supplements, and their vitamin D level went lower.
Well, yeah, you need a reputable, that brings you another topic. You should all learn to muscle test your dows. That's another topic, but that's the way you can test that. Most reputable companies, anyway, sure, most people would recommend if you get a vitamin D, if you think you need it and you're trying to protect yourself, have a vitamin D blood test occasionally. When you take your vitamin D, it should be with the largest meal of your day, a fat meal with fat in it. Yes.
Diabetes runs in my family. My sister she has to take insulin shots every day. What is the best thing for her to do?
Buy this book. Well, I mean, if she said to me, what should I do? I'd say, well, here's some information. You just go down the list and say, I would suggest you clean up your environment, you clean up your diet, you reduce your carbohydrate intake, just those things. It's hard. There's no question about it. Eating is very basic, primitive thing, and we get addicted to the foods. We'll come to something in just a minute, I guess. Okay. There's a substance out there called naltrexone. And what naltrexone does, and there's a website here on the second page, right under type 1 diabetes. What naltrexone does, it tends to normalize your immune system. It stimulates your body to make these things called endorphins. In every part of your immune system, the cells there are covered with these things called endorphins, receptors. If your endorphin levels are too low, you will be much more susceptible to becoming addicted. And by taking a very low dose of naltrexone, here again it's prescription, but I recently found that this website right down the bottom of the page, you can buy it online without a prescription. I personally think almost all of us should be on naltrexone. Now, some of us only need it probably once or twice a week. Other people might need it twice a day for a while. Everybody's immune system's struggling. Don't ever take a doctor's word. Say to the doctor, could I please get a copy of the actual lab report? And you should have a notebook with all that stuff in it. And you should know enough that you want your vitamin D level at 60. So irregardless of what he says, you've got the data here, and you don't even have to get his permission anymore to get a blood test. There's places you can go without the doctor's.
So I was actually put on 50,000 units a week. It was
Yeah,
a
that's because that's a prescription.
Exactly, and so I took that, for a year, and they tested me again, and it was only up to 17. Is there something in your body that can cause you to not absorb the vitamin D?
Well, you may not have been taking it with fat in your meal. It's just a fat-soluble vitamin, and I think unless we're getting a good dose of fat, we aren't getting the bile salts, so we may not absorb it as well. But I do not like 50,000 once a week.
No, I don't. I quit.
I think it's much better to do a little bit on a regular basis
Yeah,
in a
I
huge
actually
dose.
took myself off that amount.
Good.
And take
Well, you did the right thing in that you follow up. No matter how much you're taking, whether you're taking 2,000 or 5,000 or even 10,000, follow up with another blood test. At least once or twice a year beginning. Once you've determined that you're at the end of your, I think the best time to do it is the end of the summer, because you've gotten probably as much as you're going to get from the summer sun. And then maybe in March or April when you see how you've done during the winter from the vitamin D in your diet. Now, just because the sun's shining and you walk from here to your car doesn't mean you're getting enough. And in Oregon, the only time you get vitamin D from sunlight is between 10 o'clock in the morning and about 2 o'clock in the afternoon. It's because when the sun is below a certain angle, the atmosphere is so thick, it filters out the ultraviolet B. Okay, so it's got to be midday sun. And then after middle of September and before the middle of May, I don't care how, you can get sunburn, but you won't get vitamin D. If you use a tanning bed, if you go get tan, make sure they have B bulbs. Because A bulbs that tan you do not give you vitamin A, don't give you vitamin D. Okay, have we exhausted that topic?
So after September
Oh,
until...
yes, we haven't.
No.
The middle of September and the middle of May. So only between the middle of May and the middle of September in Oregon, that's the only time you get vitamin D from sunlight.
So there's no time of day from September on until... That's not too good.
Well, you haven't been getting much anyway. You're
Supplement.
people that fair skin, that burn easily, they still need sunlight, but you got to be more cautious. You don't want to burn. You know how much you get, if let's say you're out in a bathing suit in the middle of the day, how much vitamin D do you think you get for 20 minutes, half hour? 10,000 units. So 400 units probably isn't what we need. So in the winter months, you got to eat more fat and egg yolks and
time is that?
butter and cream and, yes,
How much time was that again?
10, 50. You don't want to burn.
Right.
So if you're out there for about 20, 25 minutes, you'll probably get about 10,000 units. If you get, at least half of your body exposed. Okay. Now, there's a list of things here I'll put that natural things that most people haven't heard about that help repair the damaged pancreas, the autoimmune pancreas. And these are, I put the link down there, that website. All sorts of good things, and you know several of them stimulates the growth and the development of beta cells. Now, islet cells and beta cells, you can use those words interchangeably. It regenerates beta cells. It repairs injured beta cells. So all these things are very, very important. And so if you're type 1 diabetic who aren't making enough insulin, this is the sort of thing that will improve your chances of getting off insulin. Type 1 diabetes is a lifetime problem. I remember once I saw this kid, he was about 20 years old, and he was childhood diabetic, and he was going blind. His feet looked awful because he wasn't getting blood flow. He found his blood sugars usually run about 300. When he went off gluten compulsively, his blood sugars came almost to normal.
Wow.
But he couldn't do it. He couldn't stay off those foods. Wheat is very, very addictive. Yes.
Speaking about wheat and grains, the Ezekiel bread, the sprouted grain, is that something to stay away from?
If you're avoiding gluten,
Yeah.
Killer Dave's bread.
No, I don't know
Killer
that,
Dave,
but
I
the
call it.
Ezekiel.
I know Ezekiel, but it's kind of the same category of Killer Dave's bread.
Okay.
Ezekiel's just that big, heavy, looks like a
that's heavy.
kind of a cow pie,
Yeah.
and it's very heavy. But the majority of it is wheat, sprouted wheat.
Oh, okay.
Yeah. Have you ever taken a handful of wheat and just put it in your mouth, and you just kind of you soak it for a while in your saliva, and 15, 20 minutes later you can start chewing it, and pretty soon you chew and you chew and chew, and pretty soon you end up with a big wad in your mouth. That's gluten and stuff. That's the gluten. It's no, don't you just at first. Now later on you might make me a liar, but at first you're compulsive. You read you don't, if you have to read a label, you don't eat it. Because MSG, you know what that stands for? Gluten. Monosodium glutamate. So you just, at first I would recommend you prepare all your own food. And then
On the website, I found a recipe where you mix up 3 different kinds of flour: rice flour, tapioca, and sorghum, along with santan gum, and I've made a Bisquick mix out of it, and you can make pancakes, cookies, everything out of it.
At first, though, I would recommend, if you're trying, you stay even away from rice. Some people. Now, after you've determined what that does to your blood sugar levels, then you can experiment. Let's say you've got your sugar levels under control and you want that Bisquick mix. Then you try it and monitor what happens. There's no way to predict. But if someone was on naltrexone, because some people even feel type 2 diabetes is autoimmune in nature. So if you get on the naltrexone, a lot of times that will help normalize you to the point where you get things under control with just that. Yes?
So what's the normal blood sugar?
For you?
No, like for my grandmother.
Well, for most people, when you get up in the morning, your blood sugar is 80 or less, that's considered pretty normal.
Okay.
And they tell us less than 120 is acceptable for diabetics.
Well, I know, but, we have a term we call pre-diabetic. So if your blood sugars are only 90 or 100, you better consider yourself diabetic, even though your doctor may not do that. He doesn't want to put you on medication. You aren't bad enough to go on insulin. So we usually get the admonition, lose weight, exercise, but rarely do they tell you to quit eating bread. Okay, where are we now? Now, another even more controversial little way of treating autoimmune diseases with urine therapy. Diabetes can be treated with urine therapy. Urine therapy is probably the one most underused therapy. It's cheap, it's safe, and it's effective. in this book called Your Own Perfect Medicine, it's difficult to find a condition that hasn't been treated successfully with urine therapy. Just the other day, one of the cases was, one of the reports in Miss Christie's book is a person that had colitis, and they treated themselves with urine enemas, and it fixed it. Well, just yesterday, I was on the internet looking around, and it had the picture of this pretty lady and said, "Boy, I've conquered my colitis." Guess how she did it? 4 surgeries, took out most of her colon, and gave her what they call a J pouch. Now, I would guess she or someone spent over $100,000 to get her functional. And the other one I just saw watch on TV today. This guy's colitis was controlled with medication, and he's just doing fine. Most of those medications, though, cause cancer. So now I know it's a huge psychological barrier to get over the idea of using your urine for therapy, but if you read a little bit about, Google that idea, Google urine therapy, read this book, you'll just see over and over again people are cured. Their condition goes away. If you're diabetic, Google diabetes and urine therapy. Amazing stuff. But it's up here, it's a problem.
What is that? I mean, they talk about like if someone's taking a lot of prescription drugs, then that goes out into the system.
Most of it comes out in your stool.
And
But
the
in
stool
your
or the
urine. Your what?
The urine or the stool?
Most of it goes out in your stool.
Okay.
Goes through your liver, get metabolized, and goes into the bile, then goes into the stool.
Okay. So that's most of the toxins.
Now, in your urine, you would get a homeopathic dose of it. But that seems to protect people from the side effects of the medication.
Oh,
Okay. So, I guess my parting comment would be, go home and read this. Go home and think about it. You've got to gear yourself up. If you decide to do this, you won't go home and do it now, because you got all this stuff in your home, and you got to, so you go home and say, okay, in a week or 2 or whatever, I'm going to do this. So you prepare your home. So you got the stuff you're really attracted to, you get rid of. And you tell everybody you're going to do it. That way, if you cheat, everybody's shaking their finger at you. But if you don't do it, so there's a little saying I like to consider frequently, and it's called, what are the consequences of being wrong? Now, if you think what I'm saying is wrong, but you're really wrong, and you keep doing what you're doing, your chance of getting the complication of diabetes is really quite high. You know, heart disease, all the other stuff that goes along with it. Now, if I'm wrong and you do what I suggested, one of these things, what are the consequences? Inconvenience, very little cost. That doesn't seem to, comparatively speaking, I think if you're wrong, it's a much greater risk. So, this book costs about $25. If you can get it online, that's about it. Any questions?
I have not had experience with testing blood sugar, except just.
You do a Bimart and get a blood sugar meter for probably $30.
Okay, you can just
and
buy
you just
'em.
poke your finger. Within a few years, I think they've actually got one now, where you don't have to get blood. You just clip it on your finger, just like they measure. You can measure the percent oxygen saturation in your blood by just putting a little thing on your. And I'm sure, I think they may already have one where you just clip it on here and it'll measure your blood sugar.
The expense is the strips.
Pardon?
The expensive part is the strips.
With this guy, I don't think you even have to have a strip.
Really?
I think it's bloodless. Yeah, the strips, they're going to get you somehow. Yeah. Okay, well, excuse me.
I keep hearing an advertisement on TV where you can, if you're diabetic, you can send into this place and you can get your
Oh, yeah.
testers.
You really think it's free?
It's not, I've gone to all the places online, and at some point, I got sent some, information, it was gonna be, everything was gonna be free, but as soon as you got the
But it's
information.
not, is it free?
No.
No, someone pays for it, yeah. No, it's
I
not.
wanted to ask you about this, naltrexone?
Naltrexone?
Naltrexone, where do you get that?
On the very last thing on the web page, on the sheet here, there's a, online source of thyroid and naltrexone. Anti-aging systems. Now, anti-aging systems will sell you naltrexone at a dose of 4.5 milligrams. Many people only need 2.5, and I would probably encourage people to begin at 2.5 because you'll save half the cost of that prescription. But it's very, very safe. You take one pill at night. And if you knew how to dowse or muscle test, you might only need one every 2 or 3 nights. And that further reduces your cost. Yeah. Yes.
I've read some about it, and I'm thinking about the connection between diabetes and weight loss and thyroid function. And so if I understand it, sort of the trunk of the tree, that the thyroid function is sort of the heat of your fire, of your metabolism, which helps you cook off sugar, if that might be a crude way.
Well, I think it helps you utilize sugar more efficiently.
Okay.
Yeah.
And then at the same time, it helps you burn the fat because your heat is up.
Sure, all your glands are going to be working better.
Right, so if your fire is cold of your metabolism, then you're going to gain weight because you're not cooking off.
Well, that's part of it, but it's a little more complex than that. But it definitely, it's just that thyroid makes your brain and your heart and your pancreas and your kidneys, everything work more efficiently.
Yeah, I've heard it's like 100 different conditions that could be caused by low thyroid function.
At least. So that's one of the first things I'd encourage people to do. Do that temperature test. Now focus on that. You might find just doing that, you could do that. You could do your temperature test and you could figure out a way to get your thyroid with iodine or over-the-counter stuff. It wouldn't take you more than a month or two to see how you're going to respond to that. So within a few months, you get a lot of things going. Yes. Someone?
Yeah.
Yes.
I didn't get how much iodine.
Well, I can't tell you how much iodine. Most people, the sources of iodine we usually use, each pill has about 1,000 micrograms. No, about 10 milligrams, 10 to 12 milligrams. And most authorities, if you read the books by some of the doctors, they usually recommend you take at least one of those a day. Some doctors will say take 2 or 3 a day. But there's no way anybody can look at you and tell you exactly what you need. And that's why we encourage people to learn to dowse for this information. Yes.
How do you, I know how to muscle test, but I don't know about dowsing for.
Well, you better learn.
I better learn. But I think I know how to do. I only know how to do it for water.
Well, you can learn to use a pendulum. All you do is a pendulum is just pretty much using the same energy fields that a willow stick does. You program in your mind what you want to find, and then the pendulum is the indicator rather than the willow stick. Yeah, and it's quicker, and it's not quite so obvious when you're in the grocery store with your.
What do you do? Go backwards and forwards for yes and
You
sideways
program.
for no or whatever?
How do you cook stew? You've got your own recipe.
Okay.
You program your pendulum. I've trained my brain to move the pendulum clockwise if it's truth, and counterclockwise if it's not. Yeah. And so I can learn in 15 seconds if something's good for me and how much to take. Now, there's no other way to get that information. So, okay. Yes, Finn?
I got a couple of questions back up in the beginning. Is there a way to heal the organ that makes insulin? Is there anything you can do?
Well, like we pointed out here, there's several of these nutrients here that help regenerate beta cells. See on this list on the second page, arginine, avocado, berberine, chard, corn silk, curcumin, flax, ginseng, all those things help repair, regenerate beta cells.
Okay, the other question is, carbs are not good, but isn't there some good carbs?
Good types of what?
Are they good carbs?
Well, sure, the carbs are okay. It depends on how your body handles them. Complex carbs are the things we should focus on. So really, we should be eating whole foods in season. See, so what season is it now in Oregon?
Berry time.
Yeah, berries, raspberries, cherries, all those sorts of things. That's what we should be focusing on. What is are cherries in season in December? No. And see, we've screwed things up by eating these same foods over and over and over again all year round. And you add to that our eating habits and our poor digestion and what they've done to the foods, we've messed everything up. They're good carbs. Carbs aren't bad, but for some people, is exercise good? Well, sure it is. But if you've got 2 broken legs, is exercise good? No. And so we've got to help our body heal, and hopefully it isn't damaged enough that we can't go back to some of these carbs. But some of us have broken our legs so badly, we're never going to be able to run a marathon. So everybody's different. But carbs are not bad. It's just we've abused them. We shouldn't be getting 60 to 70% of our calories from carbohydrates. See, unfortunately, the medical profession has been one of the main culprits in that, because for years they've been telling you, don't eat fat. Red meat will give you heart attacks. Eggs will kill you. It's a lie. It's wrong. It's totally, I'd like to call it ignorant, but they know more. Anyway. Okay. Well?
Well, I have to say
Thank you
very
very
much.
Sure. Now, if you want emails, let us know. Here's a list of our classes. And if anybody were interested, we formed a nonprofit corporation trying to spread the word, educate people, get legislation passed so doctors are free to treat you in ways that are not recognized by the medical school. So anyway,